Whether we're talking about heart attacks, strokes, or coronary artery disease, cardiovascular disease remains the leading cause of death worldwide. According to the CDC, in the U.S., a person dies every 34 seconds from CVD. Photonics innovations like angiography and laser ablation have been used to diagnose and treat these ailments for years, but new innovations could be starting to transform this field. Yuqi Zhou, an assistant professor at the University of Tokyo, has taken a particular interest in how emerging photonic devices could find an application in improving CVD care. In a newly published review in Nature Photonics, she highlights the potential for photonic technology to enhance early diagnoses and improve treatment by embracing trends of miniaturization and AI integration. That conversation is next.
Today's episode is brought to you by Hamamatsu Corporation, a leading manufacturer of devices for the generation and measurement of infrared, visible, UV light, and X-rays. Hamamatsu is dedicated to the advancement of photonics through extensive research and offers specialized systems for select applications. Visit hamamatsu.com to learn more. Today's episode is also brought to you by American Elements, the world's leading manufacturer of engineered and advanced materials. With a catalog of over 35,000 products available in both industrial bulk and laboratory quantities. To learn more, visit AmericanElements.com. American Elements. Now invent.
From Photonics Media, this is All Things Photonics, a podcast where we explore industry-shaping advancements in lasers, optics, imaging, metrology, and sensing. Each episode, we'll speak with some of the brightest minds in industry and research about the trends shaping the landscape of photonics.
Joined now with Yuqi Zhou. And Yuqi, thank you so much for giving us the time. Reading your study on photonics and cardiovascular health, we know cardiovascular disease is a leading global cause of death, heart attacks and strokes, too common for many. And focusing on emerging photonic technology that could be used to diagnose and treat issues with the heart, what made you want to focus on this subject?
Yeah, as you said, cardiovascular disease is a pretty severe problem all over the world. And it's also quite severe problem, especially in Japan, because my research is based in Japan. And in Japan, they have a very aging society. And aging problem cause more and more cardiovascular related events. And another thing is most of the well-established diagnosis or treatment method is for treat the very late stage of this disease. But it happens when you sometimes casually feel that it's not something is abnormal. So we actually want to push forward the photonic techniques into this early detection part. So photonic techniques have many different modalities like photoacoustic, optical coherence tomography, or even the current very popular wearable light-based sensors. So they could integrate together to detect the tissue function, tissue structure, or biochemical markers in real time with high specificity. So if we can combine those photonic techniques into the detection of very early stage symptom or marker for cardiovascular disease, it could help a lot with the both the clinical urgency and also technological promise. So that's why we want to focus on the photonics in cardiovascular disease.
That's great. And, it sounds like a big part of it naturally is in the prevention, right? Not waiting until things are too serious, but trying to catch them before they become that.
It's also it could cause very severe aftercare problems if they goes late stage. Because if people get people may just need to stay in bed for long term. That's what happens a lot in Japanese society. The daily care takes a lot of social resources. So that's also why the early detection, early treatment is pretty important.
Talk to me more about the ways that photonic methods are already used or are under investigation for cardiovascular disease diagnosis and treatment.
Yeah. So for current technologies, optical coherent tomography (OCT) is now like some kind of like standard imaging modality in interventional cardiology. So it allows the high resolution imaging of coronary artery walls and also the plaques inside the vessel. It enables the clinician to visualize the plaque composition, and also it used in the stenting procedure. It could help assessing the synth deployment and also de- detect some features of the some special type of plaques. And also near infrared spectroscopy, NIRS, that is also commonly used. So that is used for detect the like lipid rich plaques. That is a very special, very distinctive type of the plaque composition, and it could like guide the treatment strategy during the coronary interventions. And also, photoacoustic imaging is also pretty like commonly used way. So it's still largely in the research phase, actually, but there are many works working on the clinical trial, multi-center trial for photoacoustic imaging. The advantage of the photoacoustic imaging is it could like enables the visualization of deep tissue structures that is very useful in the clinical intervention. And also, uh, different from the diagnosis techniques for treatment. There's like excimer laser coronary angioplasty that is to use the ultraviolet laser to vaporize the thrombi and modify the plaque structure. And also, similarly, the endovenous laser ablation, that's a minimal invasive treatment to some like chronic venous insufficiency. And so in this technique, near-infrared laser energy is delivered into the vein to induce thermal coagulation and fibrosis. Like it's like closing the dysfunctional vessels. And also, laser thrombolysis is also used clinically. So they just use the laser pulse to induce the dissolution of clots of the thrombi inside the blood vessel. And but actually for treatment, it's actually still more common to use medicine to ease the condition of coagulation problem. So laser treatment is like only used when the situation applies.
We're talking about the advantages of photoacoustic imaging. Can you talk more about the advantages that optogenetic control presents, or optical wearable sensors? Because we know these are also areas where photonics can help.
Yeah, sure. So for photoacoustic imaging, I think in the recent years, a lot of research interest is attracted by the photoacoustic imaging. This technique provides deep tissue imaging with functional contrast. That is, it could see quite deep in the tissue, and also it could see very chemical specific markers. It could detect things like oxygenation procedure, and also like the uh, hemostasis hemodynamic procedure. So it, it's unlike the conventional traditional optical modalities. The photoacoustic imaging could offer high resolution with like several centimeter below the tissue, and also they can distinguish different types of hemoglobin, that is the protein in the red blood cell, and also it could monitor the dynamics in the blood flow. So that will be a very valuable tool for assessing the tissue availability during the revascularization, like the operations, and also it's quite useful for monitoring all the symptoms related to cardiovascular diseases. So also for optic genetic control, that is still a research tool mostly, and that is something like the improvement of the pacemaker. So it's more like a biological pacemaker. So it introduced the light-sensitive actuators that allows the should be usually millisecond scale confined control of the actual potential in cardiac tissue. So unlike the traditional pacemaker use the electrical stimulation, it doesn't rely on the electrode. So it doesn't cause any severe tissue damage. So in long term, optogenetic control is promising to be integrated into the pacemaker technique so that they are less invasive and they do not need the large implantable devices. And for optical wearable sensors, it's also pretty popular. There are many industrial companies working on development of the new types of optical wearable sensors. And it's already used, mostly not for the very clinical scale cardiovascular disease detection. It's mostly for like fitness tracking. So it's like the smartwatch that use the PPG or the near infrared based detection. You can see the red or green light from your detector. It enables the like long-term monitoring. That's also pretty valuable in cardiovascular related monitoring because sometimes the symptoms happens not like very continuously. It happens once and it disappears for long term. So a long-term monitoring could help catch those random abnormalities in the function or in the activities of cardiac tissues. And also for optical wearable sensors, one thing make them popular is they have very good potential to be combined with the AI algorithms that we could continuously get the data, and AI could be used for detect those data. So AI could detect the subtle deviations in the blood pressure or in the heartbeat.
Talking, these optical wearable sensors, like you mentioned, are often used for fitness trackers, something that's everywhere. And maybe not everyone thinks about the photonics that's, in the device on their wrist or that's all around them. And we don't think about it necessarily if we go to a hospital, right? Because we just want to be treated, we want to get the best care. Is there anything that's holding back hospitals or doctors from integrating more photonics technology into their practices?
Yeah, there are several factors affecting this. We also talk a bit in the paper like about there's regulatory problems or like clinical validation problems or just the cost problems. So for regulatory things, we want a medical device like no matter small or like invasive devices, it needs to pass the approval from like the regulatory bodies like FDA or something. So the approval timeline could be pretty long and it's pretty complex. And one thing makes things more complicated, in my opinion, it will be like the scientific research goes pretty fast. They keep developing new things, but the regulatory things is kind of somehow established. So it's like the research is running ahead and the regulatory is kind of leaning back. So when we put new things to the regulatory agencies, they need some time to adjust all the procedure to make sure that the new technology is acceptable to most of people. And also, clinical validation is a very severe problem. That's also what we are experiencing. So we need quite large size of data for the validation. We need to conduct multi-center trials to make sure that this devices, all the results is reproducible, is safe, and it's efficient. So we may meet some problem during this procedure, and also, patient may just do not trust the new devices that much. So the number of the available patients who want to participate in the trial is also kind of delaying the integrating the photonic techniques. And also, one thing specific to photonics is that the interpretation standardization, and that's something related with the operation actually. So in the lab data, we just put all the mirrors, the lasers, the sensors in the breadboard. It's our optical table. We can adjust them each parts time to time. But if we want to put them into the clinical situation, the medical doctors do not know much about all the optical components. They want something that we push a button and all the data comes out. So in that case, the stability of the device is a pretty important problem. So we may need more like industrial help to make a better media transition and also make it more standard for all the clinician could easily use the devices.
I know so often the technology comes first, and then laws are slower to catch up because it's new and there's questions. So a lot of times the technology is there, but then, like you said, the regulatory means have to go through and they have to check and verify it. And then I like what you mentioned before too, because not every doctor or nurse may be comfortable with photonic equipment or some degrees of it. So it also has to be user friendly, right? So it can be used quickly in an emergency and used effectively. I want to talk to what role does miniaturization and AI play in the development of these tools? I know you mentioned AI before and kind of like taking the data and spotting, hey, this is an abnormality. We've been, you have a sensor that's been on you following your normal patterns for a year, and it can recognize when there's a spike or something different. So what do these roles play in these tools?
Yeah, that's a good question. I would say media tradition and AI to me seems to be something like catalysts in turning the photonic techniques and all the optical devices into the practical application in medical environment. So for mean transition, as I just mentioned in the last question, so that decides how stable, how easy, user friendly this device can be. So, for example, like the intravascular photoacoustic and the optical coherent tomography, these two techniques can be widely used in clinical situation. I think that is highly rely on how they could be integrated into a single small device. They are not small enough to be used during the operations, during the stenting, or during the angioplasty procedures. And it could provide real-time feedback. The clinician can just hold devices for all the measurements. So you do not need to setting the instrument during the measurement or do very complicated calibration or adjustment during the operation. That is very important for all the photonic devices to be used in clinical scenario. And also, AI is also seen to be catalyst, but it's a little different from the linear tradition. So for AI, I would say it works well with the large data. We have currently the ChatGPT, large language models, generative models, and that would help a lot in turning the detection into prediction, actually, to me. So after we have a lot of data, we see different type of patients in different stages. We have their data. We could use AI to classify or catching the feature that in the early stage of cardiovascular diseases. So we could do some prediction of risk factors, not only in their habit or in their medical records. We can just see, maybe just for example, we can see their heartbeat patterns, and then we could predict that this patient is this person is in high risk of having some ischemic or having some thrombosis happening in their coronary vessel. So Also, the miniaturization and AI could work together, actually. So there's a recent work is like we use the miniaturization to make the photonic devices into a very small box, user-friendly box, and then we can incorporate this AI part into the device so that, well, at one push, the medical doctors could see the data from this device and also the interpretation of the data at the same time.
Interesting. And whenever there's work on a medical breakthrough and there's this research, when groups solve some of these questions, like we all win, right? Like we make a breakthrough, we all win because we can all, work towards an improved health. But what do you hope your study will accomplish?
Yeah, I would say our goal is to shift the cardiovascular care from just seeing, detecting to more like predictive. And also, so for this perspective, we want to do taking more data using the photonic techniques. We may do like cell imaging, tissue imaging, and also the detection, Raman detection, spectroscopy detection. We could combine all the data together to see like uh when or why this disease is happening. Like what's the feature at the early stage? What's the risk factors in the data, risk patterns in the data, so that we could say, okay, this person needs to maybe just risk. So this person may need to change their living habits before they actually get disease. Because usually cardiovascular disease is pretty fatal. Like they happens in a very accurate phase sometimes, and you may never have a chance to treat them. That is like very accurate diseases are happening. So if we could do prediction, we could before before the people actually suffer from those diseases, we could say like you have to change your habit. You have to improve your living style to prevent those diseases. And also, it ease a lot of social burden, medical costs will be eased, and also the care problem that can be solved. And also, for technical development, we want to make things more non-invasive. So previously, if the medical doctors clinicians need to do operation, it's just pretty invasive. It take long time to recover from the operation. And with photonics, we could make very small devices that is like you just need very small uh, place to put them into the vessel, and you see everything in the vessel. So that's minimal invasive is also pretty important in the clinical application. So we want to make very small, also compatible devices using photonic techniques to help with the treatment and also diagnosis of cardiovascular diseases.
That's great. And, you're thinking about kind of this ripple effect where you can help in the prevention of diseases. You can free up doctors to treat other conditions, and you can just have this, and more open resources to work in other areas. So, fixing one problem or preventing, cardiovascular issues for some can improve the health of others. Now, what I want to ask, like looking ahead, let's say 5, 10 years, and I know this is going to be hard to predict because we never know what's going to happen in 5 or 10 years, right? But what photonic systems do you think will become commonplace in a medical clinic in that time?
Yeah, I would say for 5 years, there will be more effort put into the smart optical wearable devices. That is well, based on our collaboration in between university and industrials. I think many companies are quite interested in putting their effort in developing new optical wearable devices. And currently it's only for like more like fitness tracking, but we do want something like clinical grade monitoring of all the events. And that would be, there may be some, if we keep improving the sensitivity of the sensors of devices, there could be devices that could used for clinical diagnosis, help with the clinical diagnosis. And also, for 5 years, I think there should be more like portable photoacoustic imaging devices. Currently, photoacoustic is like some of them are applied in clinical situation, some of them are still in lab. So this would be a little bit pushed forward, so that it could used as the current OCT or something. Like the medical doctor can use the photoacoustic devices in their operation for vascular imaging, or also it could be even for like the in the clinics, it could be used for outpatient if they have a very small size devices for this type of detection. And for 10 years, it's hard to predict because like, technology develops so fast. In 10 years, I would think that AI could have very drastically improved. There will be some like revolutionary improvements in AI, I hope. So in that sense, the AI-driven diagnostics with photonics could be one thing in the future. So for the photonics part, maybe people can combine different modalities. We could do multimodal photonic imaging platform. Let's say like we do imaging of using OCT and photoacoustic, or even Raman, or like this single cell imaging at the same time. And but that would create a very large amount of data. So with a large data, AI could work on comparing different module from different imaging results, and then it could be like, one thing is it could do automatic detection. It's pretty fast. It's much faster than clinician to check one by one. So it could automatically detect what's not what's different from the healthy condition. And also maybe you could do a risk scoring, and also the data could be saved for long term. So the AI could give us some insights about the follow-up planning of treatment, or the like the diagnosis results or treatment plan, something like that.
That's great. Well, we'll look forward to seeing how this evolves, and hopefully we can make a healthier world by treating such a prevalent issue that no one's immune to. Heart health is important for all of us, right?
Yeah.
Well, Yuqi, thank you so much for giving us the time. We really appreciate it, and we'll keep our eyes peeled for any new developments.
Thank you for the time. Thank you.
With that, we conclude another episode of All Things Photonics. Thank you to our sponsors, to the technical staff behind the scenes, and to continued support from the Photonics Media editorial team. As always, questions, comments, thoughts, and ideas are welcome. Let us know how we're doing via email at allthings@photonics.com. All Things Photonics is available on all major platforms and on our website, photonics.com.